healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share a nursing perspective without taking up too much of your time. We're excited to welcome back Anthony Young for the second time. If you haven't already, please go back and watch his episode dedicated to hospice and palliative care. He has over 20 years of experience when it comes to that specialty. He's a newly minted NP, and he was kind enough to share not only a brief version of his nursing journey, but also his expertise when it comes to hospice and palliative care, which we addressed the misconceptions, the differences, the criteria, who's on the team, and this was in honor of Breast Cancer Awareness Month. Today, we're switching gears, and he's going to be telling us all about the National Black Nurses Association's upcoming Men's Health Committee, which will be taking place in November. We'll learn about the role of this committee, which you can find in the greater New York area. This will be their inaugural conference. We'll go over all the details on the date, the location, what to expect, what they're going to have, if they're going to have any food for you. One of their key themes will be rebuilding healthy men. We'll talk more in detail about what that exactly means, how you can support them, and how you can connect with him. If you're new here, welcome to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co-hosts here at the Melanin Initiative podcast, along with Geraldine and Alicia, who send their love in their absence. We're a health literacy podcast. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and then to use it, to manage your health and advocate for others. It's our hope that by watching on YouTube, LinkedIn, Facebook, Instagram, or listening to any of your favorite podcast apps, that you'll be empowered to ask questions, educate on how you can navigate the system, and empowered to manage your health and advocate for others. Our second mission is to elevate the voice of nurses by showcasing their expertise like we did with Anthony during his hospice and palliative care episode. We also love to take the time to share their journey because so many people enter this industry as a first-time career, second, third, and fourth. And we just want to be able to provide a frame of reference, put a face to the career, let you know about all the options that are available to you. It's a beautiful industry, but it does come with sacrifice. It comes with surprises and challenges that can be difficult to manage. But if you have the right network, if you have the perfect mentorship match, and you find other ways to leverage your knowledge and expertise outside of direct patient care, it can be a beautiful career. And not everything is going to be taught in nursing school. And that's why episodes like this and this show in particular are really important for your journey as well as your decision making, because there's a lot of ways you can help the community and help the industry improve. And it might not be by being a nurse or a doctor. If you haven't already, please subscribe so you'll be notified when we release new episodes. Give a thumbs up, leave a comment. It helps the algorithm know that this information is important so that when people like you look for information like this, we'll show up higher in the search results. Remember, this show is for educational purposes only. The opinions expressed here are opinions alone. They are not a representation of any of our affiliations. If you're experiencing a medical emergency, you should seek medical guidance and medical attention from your healthcare provider. If you think you might be having a physical emergency, you can call 911. If you or someone you know might be having a mental health emergency, you should call 988 or text 741-741. Anthony, welcome back to the Melanin Initiative.
Thank you. I'm glad to be here. I appreciate you for allowing me to come back. So I guess I did it right the first time. So I'm back to speak to you again. So thank you.
Yeah, we love this initiative and what you're doing. We really have enjoyed learning so much about the National Black Nurses Association. Our first guest was Dr. Camilla Barnes. Shout out to her. And since then, we even had Tiffany Young-Lewis come on and talk to us about her infertility and endometriosis journey, as well as pregnancy and infant loss awareness, all part of the Greater New York chapter of the National Black Nurses Association. And so you're kind enough to allow us to help promote your upcoming inaugural conference. And we're so excited because we know that when it comes to men and Black men and brown men in particular, that there can be a whole lot more improvements in that space, and that it's so important, just like I just talked about clinicians in healthcare, that the community has community. It can make the journey a lot easier. So before we jump into the conference, if you could just tell us a brief version of your nursing journey and all the way into being a nurse practitioner, what led you to want to go there after 20 years?
Good question. So I've been a nurse for 23 years. I started out I went to University of Maryland School of Nursing. That's where I received my bachelor's degree, Bachelor of Science in Nursing. After that, I went into oncology, specifically bone marrow transplant, and how I figured that out, because that's an issue too. Sometimes you graduate nursing school, where am I going to go? So when I was in nursing school, one of my rotations was on an oncology floor. And then my last year of nursing school, I worked on an organ transplant floor, kidney and pancreas. So when I had to make the decision when I finished nursing school, the baccalaureate degree, I said, okay, I'll put the two together, oncology and transplant. So then that's how I fell into bone marrow transplant. And I really enjoyed it and caring for those patients who are very sick based on their disease. And then I've been in several roles in oncology. I've been a research nurse. I've been a case manager. I've obviously taken care of patients in the hospital, so inpatient, on the outpatient and outpatient setting too. So I've been in a lot of places from an oncology perspective. I've also worked in several leadership positions in nursing, director of nursing at a community health center. My first master's degree is in public health nursing. So then that's where my love for community and public health comes. Um, and then more recent, I say within the last 5 to 6 years, that's where my interest in palliative and hospice care came. When I worked at Johns Hopkins Hospital in Baltimore after nursing school, I did have an opportunity to care for patients who were on hospice, but it wasn't like an official hospice unit. So it wasn't until my recent experiences working with cancer patients at a local hospital here in New York City, outpatient infusion. And then after that, transitioning over to being a hospice team manager for a local home care agency here in New York. That's where then I began to develop that interest and identifying the need for more practitioners, more advocates in the area of palliative and hospice care, just to provide the care, but then also to provide education of what's the difference, what is it, what is not, et cetera. So that's where I see myself at, not only being a practitioner in the area, but also being an advocate, going around to different communities, conferences, et cetera, and then just talking about what palliative and hospice care is and what those two are not.
Wonderful. And you're really in a perfect position right now to offer some advice. So I don't want to know what advice you would give your younger self, because your younger self lived in a completely different world and in a completely different industry. Now you have the experience of 2 decades. You've gone to nursing school. You've gotten 2 graduate degrees. You're now a new provider. You've taken boards, certification exams. You've been in all sort of settings from acute care to the home care. You have a lot, and you're in professional organizations, you're in leadership. So I'm curious, what advice would you give to people right now in the world that we live in right now, knowing your experience and also knowing the trajectory of where your specialty is going?
One, always be clear on your why. Why are you in that profession? Why are you in that specialty? So that when those days come and it's very hectic, you can always go back to your why. So you definitely have to establish that. You just can't be in a place just because I'm in it because of the money. That will last for a little while, but after a time, you will get burnt out. So you always want to go back to your why. So that's one. And then number two, always network. So for me, as an introvert, that was hard for me to do in the past. But nursing has brought me out of myself, because you meet new people every day, and you have to make those adjustments and get to know people. So definitely, from the second point is the point of networking, the importance of networking, so that you can connect with people who can lead you in the path that you may want to go to, or if they don't know, they can connect you with other people within their network. So it's definitely very important to come out of your comfort zone, because we only grow when we come out of our comfort zone. So that's one thing I'm speaking to myself, because that was my own experience, but also speaking to everyone that's listening, that coming out of your comfort zone and networking with those individuals that may be impactful to the next stage of your career is very important.
And for men, Black men in particular, who might find, and in nursing and in leadership, who might find themselves the only one in the room, the classroom, the clinic, the boardroom, what advice do you have for them?
Definitely lean into the fact that you're there because you're there for a reason, because of either your knowledge, expertise, being a consultant, whatever the case, you're there for a reason. You definitely want to make sure, again, that you lean on those individuals who are in that space, that can support you. that can provide you with advice, because we don't know everything. So we definitely have to first acknowledge the fact that we don't know everything and lean into those individuals that can help and support us, because then they can support you in that space where you may be the only Black, you may be the only male, and they can provide you a source of encouragement, because there definitely will be opportunities, not opportunities, but cases where there will be discouragement. So you definitely want to make sure you have people within your circle that can encourage you, especially when you're in those places where you're the only one, or you're the 1%, whatever those cases may be.
And you mentioned networking. So what's one tip somebody should take away? They don't learn anything about networking. They didn't learn it in nursing school. They are an introvert, and you're telling them they need to do something they never done. What's one thing they should do to get started?
One thing to get started is to first, it may sound very simple, is to establish your management plan of your anxiety, because if you're an introvert, you may get anxious being around people. So whether it's deep breathing or whatever the case is, how are you going to manage your nerves when you're in that environment? Because it's going to come. So first, having a plan to manage your own nerves, and then sometimes you just got to go out there and do it. Definitely have in your mind what your why is, where do you want to go, because then those questions will be asked of you. So having clarity in your mind of, I want to do X, I want to do Y, I want to do Z, and then being able to clearly articulate that in, for example, like a 30-second elevator speech. So very quick, and communicate that. So you have to be very succinct, and very clear. So if you need to write it out before you go out to that event, you can write it out so it's in your mind of how you're going to communicate it. So having your management plan of managing your nerves, writing out what that elevator speech is, and then going to an event. That's all you can do. You don't want to procrastinate. So I'll go next week. Oh, I'll go to next week. Because as introverts, that's what we're going to do. We're going to keep on pushing off, and it never happens. So then sometimes you need to just do it. And then also you may need a source of encouragement. So bring a friend, and then they can help to support you through that moment. So definitely those are some important tips that I would leave for those introverts, we as introverts, to help us manage through that journey.
Great advice. And so much of nursing teaches us that, right? Go out there and do it, know what you're going to say, and manage your anxiety, which we don't talk enough about in nursing, is how we live with anxiety. It's just the degree to which we live it, how we manage it, and how transparent we are about the fact that it's kind of part of the profession. So if you could tell us a little bit about the National Black Nurses Association, and more specifically, the role of the Men's Health Committee.
Got you. So definitely. So the National Black Nurses Association is a nursing organization established in 1972 by a very small group of Black nurses who wanted to have a place where they could come together. Currently, that organization, or the National Black Nurses Association, is made up of over 300,000 Black nurses, LPNs, registered nurses, nurse practitioners, students, the whole gamut in the nursing profession. And again, what our goal is making sure that we're not only growing ourselves, but also growing and supporting our community so that we can improve health outcomes. And then there are 114 plus, so over 100 chapters throughout the nation for the National Black Nurses Association. And I'm a member of the Greater New York City Black Nurses Association chapter, which that chapter was started in 2017. And our motto is for the greater good. So again, going back to, we want to make sure that we're in the community, that we're providing the support, we're providing the resources so that the community can have better outcomes. They can have the resources and the things that they need for their health, be it mental health, emotional health, physical, all levels of health that the individual may need. So then that's the goal of the organization. And then obviously that trickles down to the over 100 plus chapters. So just speaking about our annual, well, I'm speaking that into existence. This is the first one. This is our first men's health conference for the Greater New York City Black Nurses chapter. It will be on November the 9th, which is 2 weeks away, exactly 2 weeks away tomorrow. It's going to be at the NYPD Community Center on 127 Pennsylvania Avenue. It will be from 10 to 3 p.m. And you will have all those details and informations provided to you. And our theme is rebuilding healthy men, mind, body, and soul. So again, rebuilding ourselves, because there are different situations, trauma, things like that, that will break us down. So what do we need to do to build ourselves back up? And then looking at mind, body, and soul. So our health is just not the body. So we have to look at it from a holistic perspective. So what's going on in my mind? What's going on in my body? And then deep down in my soul, what's going on? So just connecting all of those pieces, because if your mind is off, all the other pieces may be off. So you definitely want to make sure that we're looking at it from a holistic perspective. So then that's what we're doing at the conference. So there will be 3 segments that reflect each of those areas: mind, body, and soul. And we will have expert panelists, be it psychologists, social workers, nurses. On the body piece, we have physician, nurse practitioner. We have a great individual who has his own story in regards to improving his health. So again, making sure that we have also individuals on the panel, which we will, that have their own story, because their story may be your story. So then that may help you to move forward, and then you can connect with those individuals. And then the last one will be the soul. So what can I do to center myself? Because there are all things going on in our lives and in the world where we get off course or we're not centered. So what can we do? Be it meditation, be it yoga. So we'll have an opportunity to discuss through those things that may have us off course. And then there will be some discussion or recommendations in regards to what can we do to bring ourselves back to center with things, as I mentioned, such as meditation. So in a snapshot, that's what it is. But you did mention something earlier that I want to address. There will be food, so you will be fed. And then the most important piece about it that many people will want to ask the question, it is free. So make sure that you sign up. We'll have the QR code, the Eventbrite link. Make sure that you sign up so that we can prepare for you. We want to know how many people are coming so that we make sure that we have enough meals for everyone that's going to attend, so that we can give you the nourishment that you need in your belly. So definitely make sure you register so that we can prepare for you. And then another thing that's exciting for us, and it will be exciting for you, will be giveaways. So there will be things that you you can take away in your mind, yes, but then there'll be tangible things that you'll be also be able to take away, such as products for your skin. So just talking about that. And then I know, Dr. Kim, you're an expert in the skin area. So 2 of our sponsors are CeraVe. So there are a lot of skincare products that I was actually just going through before sitting down today. That will be available for our guests. So make sure you're there. Make sure you register, because you will only get it if you're there. And then our other sponsor is Gilead. So they will be providing education in regards to sexual health, because that's very important no matter where you're at in your lifespan, is having that knowledge of how you can protect yourself throughout your life. So in a nutshell, those are the highlights, the important pieces. It's free. You have giveaways. There'll be food. Make sure you register. That would be the most important thing, so that we can make sure that we prepare for you.
Wonderful. So you started off by talking about the importance of the mind, body, and soul, right? And as someone who has, even though I'm part of their life, also as a woman, I observe them also living out their life from the sideline. My dad, my brother, my uncle, my love bug, my male friends who I've grown up with. When I witness their life objectively, I recognize that their lived experience is much different than mine, right? Even though we have being Black in common, might be related. Specifically, being a Black man results in a very specific lived experience, and that has a huge impact on the mind. And so I'm glad you brought attention to that you're bringing attention to that, and that so many men are starting to create these spaces for each other. And what I know about Black men, what I know about nurses, is that even though it has that title, National Black Nurses Association, that it's inclusive, right? We always have room for everyone at the table. Shout out to DNPs of color. You don't have to be a DNP to sit with me. There's always room at the table. Am I correct, right? It's open to anyone?
Yes. So if you are for the DNP, if you are a master's level nurse, you're pursuing your DNP, you can be involved in the organization. And then flipping back to the conference. So everyone. You don't have to be a nurse to attend. You don't have to be a male to attend, because we know many females, be it the mother, sister, cousin, etc., that you are a drawer of your significant other, your brother, your cousin, etc. So we definitely encourage the females to register too, and bring those males with you so that we can support each other. So it's open not only to males, but also females. But if you're a female and you're coming, we want you to bring your brother, your cousin, your husband, whomever with you. But just also make sure again that you register. That's very important.
Yeah, and while I was fortunate to have my dad in the home my entire life, there are a lot of women who are, that is not their story. And so often they're looking for that community, that leadership, those voices, those visionaries. And so these kind of events allow them to have access to that, because there's no manual on how to figure each other out, right? And so just being part in the same room can make a world of difference when it comes to communication, working together, and of course, raising the next generation. Curious, what is the why behind this conference?
Well, it's the first conference, so it's an opportunity just to get out there, spread the word, communicate. But we do the Greater New York City, and not just the Greater New York City chapter, all the chapters in the National Black Nurses Association. We do a lot of community events. So in those community events, sometimes there's a gap in the number of males who are present. There's a lot of females that are there, etc. So then the goal is how do we get males in one space, having a conversation where we can talk about trauma, talk about health, and all those types of things that will be important. So again, just seeing that gap and participation in some of the many of the community events that we have. So what can we do just to have a focus time, a focus event for males to come together to hear from other males? Because no matter if you're a physician, you're a nurse, you're a social worker, you're a recording artist, we're all males. So we have similar experiences and we have different experiences, but we can all learn from each other and support each other in the growth process. So then that's the whole goal, is just bringing everyone together in a safe space. Also, we use the word bold and courageous space. So coming in an environment, being bold, saying, yes, I'm here. I want to learn. I want to be supported, but also being courageous in the sense that courageous and vulnerable, because you have to speak your story sometimes before you receive that help or the support that you need. So again, a bold, courageous, safe space is very important so that we can make sure that we're maintaining the confidentiality of the information. Also, we still know what some of those details may be that we can use to help support you.
Speaking of spaces, you mentioned to me before about the intentionality about hosting the conference at the police department. Can you talk about that with us?
Good point. So there was some feedback, let's put it that way, in regards to why at the NYPD Community Center, based on the historical experiences of Black and brown men with police. So then the response to that would be, yes, first, that we acknowledge that those experiences have occurred. The next step is, well, how do we grow? How do we move past those experiences? First, again, I do not want to overshadow the point of acknowledging that they happen. They're still occurring. But then we want to make sure that we move to how can we get to the next stage. So again, establishing that bridge, making that connection with the, in this case, as we're doing specifically with the NYPD, is at a community center. So in this community center, in addition to having space for conferences and things like that, they have a gym and they have other spaces for other activities for the community to come in. So again, just trying to rebuild that connection with the community. So that's the whole intent. So again, acknowledging the trauma behind some of many experiences that individuals have had. Also just looking at how can we bridge, or how can we grow? How can we rebuild? So then all that connects to the intent of having it at the NYPD Community Center.
Yeah, and shout out to you and the representatives at the community center, because it takes two. You know, it takes two to make something like this happen. Speaking of the location, what's parking and transportation like in that area?
So I will say this, the parking will be street parking. So there's not like a parking deck or anything like that, at least within the vicinity of the community center. So I would recommend either doing public transportation. There is a train, MTA train right across the street. The C train is the local train that individuals can take to get out to the center, and it's right across the street. So you can do that. You can do Uber or Lyft or even carpool. So there's not as many, there's not much more demand for parking. And then obviously, as I mentioned, there's street parking. So then those would be the important things to consider in regards to get into the site, and then how am I going to park my car or park my vehicle when I come.
And what's accessibility like for our friends who might be in a wheelchair or have sensory deficits?
Yes, so they do have a ramp for those who who need wheelchair access, and then there's, I don't know what the machine is called, but there's like an elevation apparatus that can be used to actually get them up to the elevator space, and then they can take the elevator up to the auditorium, which the auditorium is where the conference will be held, and that's on the third floor of the community center. So yes, it's accessible for anyone, be it blind, they have a wheelchair, a walker, any of those types of devices. It's friendly for all of those individuals.
And then is there a virtual option?
Yes, so there are many people within the National Black Nurses Association who are not in New York. And then even outside of that, all the other men that are in several states, again, outside of New York. So yes, there's a Zoom option. When you go into the Eventbrite link, you will see all those details in regards to accessing the conference via Zoom. So yes, so we were thinking of every different avenue, a way that people can connect, because we know everyone won't be able to come in person because they may be at work, but still they can be connected via Zoom. So yes, that option is available. Make sure you go on to the link, you register, and then you'll get those details in regards to the Zoom link.
And you mentioned two of your sponsors. Do you want to shout out the sponsor for the food?
So the sponsor for the food is actually our chapter. So the Greater New York City Black Nurses Association. And then from Sarah V, they've given us thousands of dollars worth of samples that will be given out to all of the participants for skincare. And I wanted to mention this, that skincare is very important. And then this is a whole other topic that can be talked about another day. But our skin is our largest organ of our body. So, and it's a telltale sign of what's going on in your body. So we will have skincare products that will be available, free skincare products that will be available for all participants. And all of that's provided by Sarah V. And then Gilead is providing sponsorship also for other expenses that we will have with the conference. So we're definitely appreciative of both of our sponsors, in addition to our chapter who is sponsoring the food for us. Also want to shout out all of the committee members for the men's committee, because it's not the work of one person, because it's too much work for one person to do and to have all the balls in the air and keeping everything going. So I want to shout out all the committee members for the men's committee and all of the chapter members outside of the committee members who are providing support to make sure that the conference is a success. So yes, we are looking forward to it, and we're thankful for all those who have brought us to this point of making it possible.
Yeah, we love CeraVe. One of the reasons I love them in particular, not only as a company, but also for the public, me being part of the public, is their products are accessible. The price point is friendly to the pocket. They have a wide range of products for all types of skin. And when you visit their website, they provide a lot of education to make it really easy to pick the right product for you. And yes, when it comes to the skin being the largest organ, and men in particular, we just want to make sure that you take the time to go all the way down and take care of your feet. Feet are often the first to be neglected. And because we're talking about our community in particular, our risk for things like diabetes and infections and amputations are so much greater, even vascular diseases. Shout out to Dr. Yvette Conyers. She talked to us about amputation prevention, right? We were in the business of preventing complications. And if you just take care of your feet, I tell my patients every day and their family, keep it clean, dry, and moisturized, and you can save yourself a lot of money. But as a clinician, and shout out to my students, and one of my professors who brought it to my attention how important it is to look at the feet, it can be the first sign that your patient needs additional support in those activities of daily living, the caregiver, their disease process, because when the belly gets large, when the breathing changes, when your ability to bend over starts to get impacted, the feet are the first to be neglected. And far too many patients with diabetes have told me they never knew they need to see a podiatrist. And we want to make sure for you that you know, just like you need to see primary care, the dentist, and the eye doctor, you need to have a podiatrist on your calendar every 3 months. And shout out to the DC Foot Doctor. That's his name on YouTube. He has 500,000 subscribers. Literally, he's a podiatrist in DC. He makes a ton of educational content for the patient. And as a clinician, I've taken some of those tips. He has an Amazon store. So I send all my patients to watch his content. And he's just a beautiful example of how to provide bedside care without making the patient feel bad for their situation. So you talked about the skin, like you said, it's a whole nother topic. As you see, I can go on a whole nother hour about it. But yeah, shout out to them and for the committee, because those kind of sponsorships take more than an email. And so we want to recognize that. And I wanted to plug being part of professional organizations, because we tell our students you need to network, right? And we tell them the importance of mentorship. And then we tell them the importance of joining professional organizations. And one thing you can do in a professional organization that I think balances burnout, like I talked to the Queen, Dr. Danielle McCamey, about recently, is sharing your other talents, right? If you spend all week taking care of patients, you can come to this professional organization and help with the catering, help with the designing, help with the audio or the AI or the tech, anything. And that can just help balance out some of what you might be a little burned out with during your day-to-day. And that's just another way you can lend your talents and your expertise with our professional organizations, as well as gain that leadership networking that puts you in a spot that makes it super easy to network. And if you are a student, oftentimes membership is free or comes at a very, very low cost.
I also wanted to mention too, since we were talking about the skin and the feet, another panelist in the body segment will be a dentist. So our oral health is also important too, because then if that's neglected, then that impacts other parts of our body. So that will be another expert that we will have at the conference. And obviously we won't be able to talk about every topic comprehensively, but we will touch on those topics and it will start the conversation. And our goal is to continue the conversation within the community. So it won't be a one and done. So there'll definitely be more work that needs to be had even after the conference.
Yeah, because this is just the inaugural, right? So it's half a day, but in a not too long far in the future, it's going to be a 3-day weekend event, and you're going to be able to explore so many topics. And so we look forward to that. You mentioned that anyone can come, and so we like to bring attention to our vulnerable populations. Me, Geraldine, and Alicia are 3 straight Black women, and so we always want to make sure we think about people who aren't sitting at our table. So we've already talked about people who might be have physical challenges, and we've talked about people with sensory deficits. So let's talk about the LGBTQ community as well as children.
So everyone is invited. From a children's perspective, obviously we don't want to be a situation where it disturbs the dynamics of the environment. So, but we know childcare may be a challenge. So if you need to bring your child, we're not going to turn you away. But definitely the focus is for adults, males, females, any community, LGBTQ plus, transgender, etc., everyone, because you're still a male, regardless of what you, who you love. We're still males. And we still have family members who are males. So if you're transgender and you've gone through the process or the transition, you still have family members that you can support. So wherever you are in the community, no matter who you are, everyone is invited to come to the table, be it in person or via Zoom. So definitely. But if you come in person, again, you get the food and you get the giveaway. So just keep that in mind too when you make that decision.
Yeah, and for our transgender community in particular, if you haven't had gender affirming treatments or surgeries and you still have your biological organs, it's really important that you disclose that information to your clinicians, your providers, and that you're still aware of your risk associated with those organs. It's Breast Cancer Awareness Month. We know men can still get breast cancer, and it's a great opportunity to inform your clinician of the appropriate terms that won't trigger your body dysmorphia or anxiety, right? When we start to use those terms, if you're trying to make that transition. And we want to make sure we know, because me personally, my mom has had breast cancer, and I have a male in my family who also has had breast cancer. So we never want to leave them out. But also your reproductive organs, issues you might be having, or risk for prostate cancer, those kind of things, you still want to be getting those recommended evaluations if you still have those organs, even if your gender identity is different than your biological sex at birth.
You made a good point. I want to piggyback on it in regards to, since we're in the month of breast health, awareness, and you talked about males, so then that may come up in the conversation at the conference. But according to the American Cancer Society, over 2,000 males, even though that seems like a small number, and compared to the number of females that have died, 2,000, not died, but diagnosed. Over 2,000 males have been diagnosed with breast cancer in 2024 at this point. So just keep that in mind, even though from a big picture perspective, it seems like a small number, but one is too much. So then we want to keep that in mind, that yes, males can get breast cancer. So we want to make sure that we know our bodies, and that we're going to our annual visits just to make sure that a nurse practitioner or a physician can do further assessment to determine your plan of care. So very important point to make. Yes.
Yes, or our physician associates. Shout out to them. They just have
yes. Yes.
They also specialize in every area that you'll find a doctor or a nurse practitioner. So how can we support the committee? The committee.
So the first thing is to the QR code and the Eventbrite link will be available for you. So register for the event, attend the event. If you can't attend in person, definitely attend via Zoom. The most important focus is that you get the information, and then obviously let your whole network know. So you'll have the flyer, you'll have the link, so you can share it within your community, at your church, YMCA, wherever it is that you are. Share it with your community so they will be aware of it, and have them come too. Again, it's free, so you don't have to worry about what your pockets are going to say. So it's free. You can come enjoy, network. You can eat, get free giveaways, take care of your skin. I put my moisturizer on this morning. I'm drinking my fluid. I put some more in there. I wash my face, do your cleanse, and then moisturize your face, and keep your feet together, as was mentioned. I did that this morning. So just saying, we're not just saying it, we're doing it. So we have to be practice what we say. Definitely.
For those listening, we both showed our water bottles. I have more to drink than Anthony. He's a little bit ahead of me, but maybe that's not my first one for the day. I'll just put that out there. Are you all going to put this on LinkedIn, like the video, like the conference? Because we get so much support over there in the community.
Yes, we can. Have not thought about that, but definitely I will make note of that, so that we've advertised it on LinkedIn, but definitely making it available for individuals to access it that way too.
And YouTube.
Yeah.
And depending on how many followers you have, you can have it on Facebook.
Yeah. So we will have it will be live streamed. So we have a person that again, from our sponsorship, that we will be able to pay to be the videographer, because that's a very important piece. So that or the live stream piece of it, so that people can be connected that way. So he will be managing that. He's an expert at that. We'll have a photographer, and then also a videographer, so that we can document the event. So we definitely have the various pieces in place, all because, again, of the sponsorship. We've been able to put some of these things into place to make sure that it's a successful conference.
Wonderful. Any last words, and also share how people can connect with you?
So you can connect with me primarily on LinkedIn. My name is Anthony Young, and you'll be able to find it that way. You'll be able to see me by the beard, so you'll know. I won't have my glasses on, but you'll see the beard, so you'll know who I am. So on LinkedIn, I am on Instagram and Facebook, but I don't check those as much. So the best place is to first get me through LinkedIn, and then questions about nursing, questions about men's health, questions about the conference. You can definitely reach out for that. And then I want you to attend the conference. So be it males or females, make sure that you register by accessing it via the QR code or the Eventbrite link. And then sharing that information with other individuals. So that's the main goal. It's just we want to be able to provide the information to the community, but we need the butts in the seats. We need the butts in the seats, and then people logged in on Zoom to be able to take in that information. So that's the intent. Register, 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 share, share, share. And then we are happy to see you either in person or via Zoom on November the 9th from 10 to 3 p.m. at the NYPD Community Center, 127 Pennsylvania Avenue. That's in Brooklyn, New York. So those of you in Brooklyn, you will be good. You won't have to travel so far versus us on the other end of the river. We have to come a little further, but hey, it's no problem. We're supporting the community, so we'll come where we need to come.
Wonderful. But on LinkedIn, I still don't see your face. This is it, right?
Oh, it should be my face. When I looked earlier, it was there. I don't know. I'd look back and see why it's not showing my face.
Yeah, I don't know.
So my name is there. So you know Anthony Young. I'd have to figure out why my face is not showing.
But it has everything else. It has that you're in New
Yes.
York, the palliative hospice. So that's how I knew it was you.
Yeah.
But yeah, your face
I have to
isn't
figure out
there.
the face piece. Yeah.
Yeah, and then shout out to Dr. Danielle McCamey once again. Once
Yeah, she's great.
you attend this event, you're going to network, but you have to be prepared. So you fill out your LinkedIn page, use ChatGPT to help you to put together an about section, take a professional photo, just something with a white background, look nice and clean. And there's a QR code on LinkedIn. So when you go there and you meet people, you can just show them your QR code, both of you, make your connection, send a message right away, say, hey, it was great meeting you at the Men's Health Committee. I look forward to our lunch next Saturday. And then actually go to that lunch or some video chat or whatever, or I look forward to being a member, or I look forward to talking about preceptor opportunities. I look forward to working on this publication with you. Whatever it is, be intentional.
Yeah, that's one to piggyback on what you just stated, and we mentioned earlier is network, especially at the men's conference, because you don't know who has a similar story as yours, and they can help you, or someone may have a story that's connected to someone that's in your community that you can then you can connect those two individuals. So at some point in life, all of us are connected, but we can't find out those connections if we're not coming together. So definitely take that opportunity at the men's conference. So I encourage you to do that now. Be prepared to share what you will need to share at the conference. Network. So that's another thing. Register, invite someone, and then network when you come.
And then share it once it's posted on social media. Share it with everyone.
Exactly.
Well, Anthony Young, thank you once again for sharing your expertise. We thank you for your commitment, not only to our practice, but to the community. And we just thank you because we know you're working, you're in school, you're part of this committee. And so we hope you have some rest in your future. We know nurses can do it all, but we don't recommend that being the goal, or that when you find yourself there, that you stay there.
Yes, I'm so excited about the conference. Thank you so much for this opportunity. So we can make sure that it's put out there for everyone to know about. So thank you so much. I appreciate you.
Yeah, I'm going to send my uncle too.
Oh, yeah.
Remember, everyone, you can email us your questions or show ideas to tmi.melanin@gmail.com. If you haven't already, there's still time to subscribe to our YouTube channel, follow us on every social media platform, and leave a comment and rate us on the Apple and Spotify podcast. It lets the algorithm know that this information is important, so that when people like you look for information like this, we'll show up higher in the search results. You can find all the resources that we mentioned today, as well as how to connect with Anthony, in the description box. We release new shows weekly on Sundays at noon Eastern on YouTube, LinkedIn, Facebook, Instagram, and the audio drops at 5 a.m. So our night shifters can be the first to get something and not the last. So day shift has something to listen to on their way in and maybe play during huddle. We thank you all again for watching, and we'll see you next time.